Hi, I'm Walter Medlin of the Bariatric Medicine Institute in Salt Lake City. I'm a bariatric surgical patient myself, a sleeve gastrectomy 10 years ago. And I want to talk today briefly. I'm going to replace this with a much longer or more extensive talk on diabetes soon, because this really is the number one reason for people to have surgery. Really, this is the only one that I push for. When people have diabetes, for instance, a 40-year-old male who is about 100 pounds overweight, so think somebody who 250 to 270 pounds who has diabetes, has about an 8 in 100 chance of being dead by age 50. Okay, we're not talking about old age here. We're talking about 8 in 100 40-year-olds being dead by age 50 if they have diabetes. And it's usually from heart attacks, and those I call them quiet deaths, because nobody, when I was 44 and had high blood pressure, type A surgeon, nobody would have been that surprised if I had a stroke. Nobody's that surprised at these guys having a heart attack and dying, or sometimes other issues, but usually stroke or heart attack. With surgery, the risk of death goes down from 8 in 100 over 10 years to 2 in 100. Now, those are 6 living dudes who would have been dead. The other 90 guys who might not have been dead, and the numbers we have are for males. This is reasonable for females as well, but I don't want to quote numbers that I don't have. They all have improved quality of life as well. So I'm going to throw a couple of numbers out here, and the main number that you need to know is in terms of studies showing people off of medications and clear of diabetes 5 years after surgery, the number is about 90%. With duodenal switch, a little more than 90%. The number with sleeve gastrectomy and gastric bypass, depending on the study, is somewhere between 25 and 50% of people off of medications. However, most of these people are still very well controlled in their diabetes, and in fact, many of them, the folks who are off of medications, qualify as remission of their diabetes. Remission. Remember that when you go talk to your endocrine doctor, and a lot of endocrine doctors are coming on board. They actually were sort of haters of surgery for a while, believe it or not, because they viewed that as risky. The risk of surgery is less than the risk of having your gallbladder out or having a hernia repaired, and less risky than untreated diabetes, and less risky than some of the medications even. But it's not zero risk, and I respect that. A lot of endocrine doctors are coming around now to the fact that true remission only happens with surgery. There are very few described episodes of remission when people have diet and exercise programs. There's diabetes prevention program that's been very well studied that is effective in a population sense, but for an individual, this is your best bet, having an operation. And again, duodenal switch is better for this than gastric bypass. I was just having a conversation with a surgeon online, with a physician online who was asking about her having diabetes, and she had a BMI between 30 and 35. So her insurance wouldn't cover it, and she was going to do self-pay. And she was asking me who to see in her region, and there are docs in almost every region. And I just made the video about medical tourism. This is one of those things where if you decide you want to look into duodenal switch, it's probably worth traveling. If diabetes is your primary reason for seeking surgery, that being said, I have a lot of patients with severe diabetes who choose to go with sleeve gastrectomy. I don't think that's unreasonable, because we can upgrade a sleeve later to a duodenal switch if the patient decides. I am very reluctant to do gastric bypass because it's a mostly dead-end operation. It is a huge job and a huge risk to revise it to duodenal switch if the patient doesn't like their results with gastric bypass. So that's my main issue about bypass. That's just the intro for diabetes. I hope you will come and talk with us more. I do want people not to feel guilty if their diabetes persists. They're still well treated. They're still very happy. There are a few patients I know who actually had very little impact, but very few patients. Also, we should always talk about type 2 diabetes is mostly what we're discussing. However, I have operated on many people with type 1 diabetes who then had features of type 2 with what's called insulin resistance, and they were actually able to drop their insulin dose by quite a bit, and it seems to improve outcomes in at least some people in terms of the damage that happens with kidneys and eyes in particular. So just because you have type 1 diabetes does not mean you can't have bariatric surgery. It's definitely a different discussion. It's definitely a different target that we're going for. But I've actually been quite pleased when we've been able to operate on people with even type 1 diabetes. But we're mostly talking about type 2. That's most adult Americans these days who have weight issues have mostly type 2. Anything else for right now? That's a good start. I think I don't want to keep this too long, and thank you for your attention. I'm Walt Medlin, BonusLife.com. As always, our real goal is your quality of life, which is to be a butt-kicking 80-year-old or better. All right, thank you. Next time I'll remember to smile more while I'm talking. I'm thinking so hard, smoke comes out my ears, but I really appreciate the people who've already been viewing our videos on YouTube, and I'm really excited to get these up on the website.